Assalamualaikum warahmatullahi wabarakatuh. My name is Ajeng Viska Icanervilia. I am from the Department of Radiology, as well as Clinical Epidemiology and Biostatistic Unit, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. I would like to give an introduction lecture about literature searching as part of the medical students practical session in block B5. Practical is aimed for students who have the skills to search evidence or research articles using PubMed systematically. Evidence-based medicine, EBM, is an approach in medical practice to optimize decision-making of patients' care by using evidence from well-designed and well-conducted research. EBM integrates clinical experience, patient values with the current best evidence. The current best evidence can be gained from doing searching systematically. The practice of EBM starts with generating question related to patient problem. And then it is followed by seeking, appraising, and applying the evidence. Generating question related to patient's problem, or we call as clinical questions, could be done by determining the PICO. P for patient, population, or problem refers to who are the relevant patients. I, intervention or indicator, meaning what is the management strategy or diagnostic test or exposure that you are interested in. C for comparison or control is what is the control or alternative management strategy, test, or exposure that you will be comparing with the one you are interested in. And then O for outcome, what are the patient relevant consequences of the exposure in which we are interested in. It is important to use all four parts of the question if possible. The example is, if I have question of whether antibiotic can cure common cold or not, then I can make PICO as follow. The problem is common cold, intervention is antibiotic, comparison could be possible, and the outcome is cure rate. There are several types of clinical questions, including therapy, diagnostic, and prognostic question. For therapy question, this is one of the examples of a well-formulated therapy question, which constitute from a well-defined PICO. For people living in endemic areas of malaria, will be the problem. To insecticide-treated bed nets and curtains is the intervention. Compare with no bed nets or curtains is the comparison. Prevent infection with malaria is the outcome. Then this is the diagnostic question. Diagnostic questions are concerned with how accurate a diagnostic test is in various patient groups and in comparison to other available tests. This is the example of a well-formulated diagnostic test. A healthy or immunosuppressed person has a problem. How is the accuracy of interferon release assays or IGRAs is the diagnostic test or indicator compared with chest X-ray as the comparison for diagnosing latent tuberculosis as the outcome. Then this is the prognostic question. Prognostic or prediction questions are concerned with how likely an outcome is for a population with certain risk factors. This is an example of a prognostic question. HIV positive. Does the risk of vertical transmission, is the outcome, depend on the maternal viral load? Is the exposure? In a prognostic question, the intervention is usually being changed into an exposure or the risk factor that we are interested in. Prognostic question, sometimes questions can consist of P, E, and O only. If the best evidence are different from the different types of questions. In every case, however, the best evidence comes eliminating by therapy questions. The best evidence is systematic review of randomized control trial. Or also it could be a randomized control trial study itself. Whereas for prognostic question, the best evidence is a systematic review of a cohort study, or it could be a cohort study itself. When doing a literature article searching, we do not expect like this man with his fishing rod, fishing in one particular spot on one particular river and targeting one fish at a time. Instead, the search needs to be on a much larger scale. Like this fishing trawl, we will need to search in a number of different locations, thoroughly searching for all information that meets our eligibility criteria. This might mean that we pull up more irrelevant material, but it will also reduce our chance of missing something important. So, we need to build a search strategy, conduct a good searching. First, we need to use the PICO. And second, we can build the free text word that we want to use as keywords. The third, we can decide the medical subject headings or MES. However, in this practical session, we will not practice how to develop the MES. And then fourth, we have to use Boolean operator and or. For structuring the search strategy, we need to go back to the PICO format, which we use to map out our clinical question. And we also will use some of these components, the same components to design our search. And then we need to define the text word, including the synonyms, and then the related terms, opposites, international terms, alternative spellings, and plurals. And then starting by focusing on the 2 or 3 most important concepts for your topic. Most search strategy will include at least participant and intervention. To make the text word, we can use the truncation. Truncation is putting an asterisk in a text word, which may act as a wildcard indicating any further letters. For example, if we want to search for child, children, or childhood, we can just type child with asterisks, and it will reveal any word with the letter of child, continue with any other letters. And then if we want to search for diabetics or diabetes, we can just type diabetes with asterisk. And it is also applied for diagnose or diagnosed or diagnosis or diagnostic. Then we can just type diagnose with asterisk. Then we can apply Boolean operators. There are two main Boolean operators. Words we can use in search strategy to bring terms together. So the first is or. If we say we want to search for literature that contain the word of bicycle or the word of helmet, this makes our search by putting or, it makes our search broader. It will find any literature that has one or the other word. Alternatively, we can use and. If we say we want to find literature that contain bicycle and helmet, its record found must have both of those words. It will narrow down our search. However, to bring our search together, we need to use the combination of both or and. Let's try making a search strategy using the following scenario. A 50-year-old man, his father died at age 60 of colorectal cancer. He wonders if he should be screened for colorectal cancer. Fecal occult blood testing is available in your setting for screening colorectal cancer. The patient asks you, as his family physician, if the screening could prevent him from early death due to colorectal cancer. So the possible clinical question is, in adults screened with fecal occult blood testing compared to no screening, is there a reduction in mortality from colorectal cancer? From this clinical question, we can define the PICO like this. The population is colorectal cancer. The intervention is screening. The comparison is no screening. The outcome is mortality. And in this side, you can see this is the synonym of each of these keywords. But since this intervention and the comparison have similar keyword, which is screening, so we may omit the comparison, and it resulted as low. Then we will use the Boolean operator or and like this. So or is usually used to combine the synonyms so that we can expand the search by collecting articles which use one or more of these terms. And then we use the Boolean operator and to combine all the PICO components. It represents the small area where all three search strategy will be like this. Colorectal cancer combined with or bowel cancer. This is the synonym. And then its PICO component is combined with Boolean. Will be like that. And now we will practice searching with the strategy that we have made before. The question is where to search. In this practical session, we will use PubMed. The reason is because PubMed is a free search engine accessing primarily the Medline database. It is the premier source for biomedical literature and one of the most widely accessible resources in the world. In the front page of PubMed, you could see Advanced button. Please press this button and we will use this for our searching. The step-by-step instruction is on the PowerPoint, but I will show you directly from the PubMed page. Please click this Advanced button in the front page of PubMed. And then we will enter the Advanced searching page. This is what we call as a search folder. So we need to put all our keywords into the search folder one by one. We can start with the keyword of P, which is colorectal cancer. So just type here. And then for this lecture, I will only limit the search in the title. But in the practical session, you will be asked to search using title or abstract. Here I will use title. And then click Add to History. Add the keyword one by one. So after this, the synonym of colorectal cancer, which is bowel cancer. Then choose title, add to history. And then I want to add the keyword for the indicator, which is screening. Here I use screen asterisk so that it will reveal any word screened. Choose title, add to history, and then and then continue with the outcome keyword, which is mortality. Title, click add to history, and then death. And then survival. Add to history. And then we will use the Boolean operator of OR. This is to combine the synonym together. So how to do that? First, we will combine the word in P, which is colorectal cancer and bowel cancer. So click add and get and add. We'll go to the search folder automatically and change the Boolean operator into OR. It means we will reveal any paper which contain the word of colorectal cancer or bowel cancer. Click Add to History. And then now combine the indicator, which is screen and early detection. Click Add, and then put or Add to History. Last, we add the outcome and then put Boolean operator OR and then add to history. This is the number of paper that we gained. So by using OR as Boolean operator, we actually expand our search. So we gain so many paper. But now that we want to do is to combine the PICO component together by using the Boolean operator N. So we add the P, and then we add the I, and then we add the O. Put the Boolean operator N, and then click Add to History. This will automatically narrow our search. So now we only get 140 articles. So by choosing, by limit our search in the beginning with title only, you limit your findings for those keywords only in the title of the abstract, the title of the article, I mean. If you do not limit only to title, the keyword will search in anywhere in the text in the article. So now we will click this button. So we will open what are the articles that we actually gained. And then it will appear like this. So now we have 140 papers. However, I am still not satisfied because I want to find, for example, paper with the clinical trial design. So what I will do is, what we can do is actually, in PubMed, you can make a limit of your searching. It is placed at the left of PubMed. You can limit the searching by clicking Customize and choose the category of limit. For example, the study design. In this practical session, you will be asked to search for a randomized control trial. So you can choose this. Or maybe you can also limit your searching according to the text availability. Maybe you only want the free full text one, or the based on the publication date. So for example, you only want the paper which published in the last 5 years. So in this lecture, I will choose clinical trial only. Let's see how many paper did we get. So we finally get 13 papers. Now I will go back to the lecture, to the PowerPoint. To sum up our lecture, to do the literature searching, use your PICO, generate the text words by considering synonyms and the usage of truncation. Finally, please use Boolean operator OR and AND. Now, these are the practical activities. Student will do pretest for 10 minutes. Please see the link. Each student consult the PICO to the instructor. So you are expected to be ready with the PICO before the practical session is started. So when we start the practical session, each student will be given 2 until 3 minutes to consult the PICO to the instructor. Students will do searching with PubMed based on the PICO. So the P or population should be the patient with disease of tuberculosis, malaria, pneumonia, diabetes mellitus, hypertension, or other diseases for general practitioner competences. Whereas the I or intervention could be found from the National Formulary 2018. And then the outcome of the study is categorical, more preferable if it's dichotomous outcome, or it can be any other clinical outcome. Please limit the search in the title or abstract. And please look for a study which used RCT or randomized controlled trial as their study design. When students find the article, please consult the instructor for the appropriateness of the article. Students complete the practical form. You can download in Camel and submit that form as well as the article that you found into the Camel. This is the end of our lecture. Thank you and good luck.